The next topic we want to look at that commonly presents in the cardiology unit is chest pain. Chest pain is a very important symptom that patients come in complaining with, and what we need to firstly know about chest pain is the types of chest pain, what to suspect, and then what to do immediately. So chest pain causes, I know that in medical school we often focused on the cardiac causes of chest pain, but there's other causes too, such as musculoskeletal, respiratory, psychiatric, and also some non-specific causes. So when you get a patient with chest pain, we don't only think cardiac or respiratory, there are other causes too. And then we also but in this section, because it's cardiology, we just want to focus on cardiac causes. And cardiac causes of chest pain are normally your stable angina, pericarditis, dissecting thoracic aneurysm, and arrhythmias too. Now, the types of chest pain that presents, so we have tight pressure, where a patient comes in and saying they feel tight chested, and usually they'll say this is radiating to my shoulder or jaw or arm or neck. Each time you get this, think ischemic, think this is an ischemic probably myocardial ischemia happening here. This is an ischemic type of cardiac chest pain. So the one that is tight pressure radiating to the shoulder, the neck, or the arm. And then if the patient says the pain is sort of tearing between the shoulder blades, we are thinking here dissecting aortic aneurysm. And if they say I have pain in my chest and each time I sit forward the pain is better, we're thinking pericarditis. We will go into more depth in these different conditions just to know how to go about investigating and how to identify. And in terms of a pleuritic chest pain, we're thinking pulmonary embolism. And how do we then manage? The first thing we want to do, we do a 999 call. So this is whether in or outside of hospital, we would say, okay, if and when do we do a 999 call? So if the pain is now or it was within the last 12 hours, if somebody says, look, I've had this tight pain in my chest that's been radiating, we do a 999 call. We ask the patient to sit upright, right? And then if possible, we would give diamorphin or a GTN spray, which is a nitroglycerin spray. If oxygen sats are less than 94%, we also want to quickly do a 999 call. And we can also give, in this case, we can also give aspirin as 300 milligrams, right? Unless it's contraindicated, of course. And then we want to do same day admission. If a patient has had chest pain, this is very critical. We want to do same day admission. So if the pain has been in the last 12 hours, we would do same day admission. And even if the pain has been in the last 12 hours, but their ECG is normal, we still do same day admission. If the pain has been in the last 12 to 72 hours with no complications, we still want to admit the patient for observation. And lastly, another method, a method of management that we can take is rapid access to the chest pain clinic. So if they've had pain more than 72 hours ago, send them to the chest pain clinic. If their ECGs, they have troponin levels elevated, send them to the chest pain clinic. And also in this case, we still give aspirin, but we give 75 milligrams, or we give a GTN spray in the meantime. Just note with the GTN spray, you use it there and then you repeat after 5 minutes, and you check with the patient if the pain has gotten better. If not better, we need to treat this as an emergency and call 999. And so that's it for chest pain, and sort of maybe identifying what to suspect and what to do as an immediate action.